So I have your letter, and I wanted to, just kind of chat with you. I understand some of your concerns, and wanted to give a chance to, hear you explain a little bit more where you're coming from, and perhaps just provide my perspective if that's valuable for you.
Yeah, sure. I guess I just want to start off by recognizing that COVID-19 is very real, and has impacted and killed thousands of Ontarians. As like a follower of Christ, I believe that every life matters, and that it truly breaks my heart for every single life that is lost to COVID. And for those who are grieving those precious lives, because every lost life is tragic, no matter how old they were. And like I firmly believe that those lives mattered, and that each life lost represents a grieving community. But I also kind of wanted to acknowledge that there have been thousands of lives lost to the unintentional consequences of lockdowns, and that there will be thousands more if they don't end soon. I personally lost two friends to the cost of lockdown, one by suicide and one by overdose, and that has greatly affected me. And I know many others who are losing loved ones to the cost of the unintentional costs of these lockdowns. I believe that those people kind of deserve to hear the government kind of take responsibility for those deaths that were unintentionally caused. And I firmly believe that that lockdowns kind of just need to end like very, very soon, because each life lost represents a grieving community and the death of someone who's made in the image of God. And I just have some concerns with the government's response strategy to the COVID-19 pandemic.
Well, first of all, Rebecca, let me just say it's very refreshing to hear someone speak about how their faith informs both their approach to life and to public policy. And as a Christian myself, it's always something I'm striving to ensure that we're approaching issues with faithfulness and effectiveness, and trying to strike a balance that, of course, reflects the necessity of the Christian approach, and also takes into account just the variety of perspectives and even different data that's surrounding these issues. I have to also say you had one of the most thoughtful, if not the most thoughtful and well-researched papers that I've received from anyone who is asking for the lockdowns to be lifted since, frankly, last year. And although I don't know if I would agree with all of the, correlations that you might claim as a causation for some of the pieces that are laid out in the letter, I still think it was extremely well written and extremely well researched. So I just want to begin by acknowledging that and thanking you for that. I also want to, say, similarly to yourself, I recognize that there are impacts to lockdowns, and that they're imperfect solutions for the challenges that we're facing, both as a province and as a globe, and as a society around COVID-19, and assure you that I have been advocating for a more balanced approach than what we see perhaps reflected in all the government policies, while also recognizing some of the constraints and necessary restrictions that are around my own speech, just given that there are caucus dynamics and confidentiality and non-disclosure agreements as well that are always in place. But I want to say I respectfully recognize a lot of the concerns that you've raised, while also not necessarily agreeing with the assertion that we haven't taken a balanced approach. Although, there's always more that can be done, and I think there's history that will show we've made mistakes and errors, and I'd be the first to say it. We're going to be making errors and trying our very best to avoid them. But I also do believe that when you look at other jurisdictions across both the world and especially here in Canada, when you see the pressure that there has been to, frankly, have an entire shutdown of society as a whole since last October, already in the second wave, and people who are vehemently pushing against us lifting any of the restrictions that we have been lifting as a response to the necessity of ensuring there's societal, economic, and other pieces that are being considered. I do think we have struck a balance that you mentioned in your possible solutions piece, for example, allowing the economy to begin to recover so that we have the resources to support those who are vulnerable. That's definitely something we're trying to make sure is included, while recognizing that it's very difficult to have a healthy economy without healthy people. We've seen that in other jurisdictions, as well as you mentioned, instead of complete lockdowns, have targeted lockdowns to the industries that have the highest death toll and outbreak risk. And that's really been our approach this last few months, especially in comparison with last spring. So if you looked at where last spring's lockdowns were, it was a much more widespread approach that really, I mean, everything from construction to office buildings to everything in between was shut down when it came to the economy, and every societal area was restricted to 5, with the color-coded approach that has far fewer sectors of the economy and society that are as heavily restricted, with an attempt to approach this from more of a percentage approach that's, again, still informed by our chief medical officer of health and their team's advice around these issues. I do think we have struck a better balance, again, recognizing that there's always work that needs to be done, and I'd be the first to say that there's areas where it's been flawed, and I try to raise those areas regularly. But I do think we're on our way out of this. I do think we'll see continued lifting of restrictions, especially with the vaccinations that have now been reducing hospitalization and death rates amongst seniors and the most vulnerable in society, which obviously is one of the reasons that it drives so much of the hospitalization concerns, because of the other impacts. And yeah, I just respect the fact that you've taken the time to put your thoughts to paper and share those with me. And assure you, I do take it seriously and read every type of this, every type of feedback such as this.
Okay. I was also wondering, just like I think you mentioned just kind of like an exit strategy. I was doing my own research, like, after writing this letter, and it said that, public health said they're looking for a 70%, of the population to be vaccinated. Is that still correct?
So I haven't heard the exact percentage as to what percentage would need to be vaccinated before like everything was back to normal. I know as the vaccinations increase, there's going to be more and more lifting. I know the big question people ask is like, oh, when are masks going to be no longer mandatory, and when our church is 100%, and when are people going to be able to go back to the Rogers Center and things like that. I don't know exactly which dates those are at. I know I've heard the number 70% for herd immunity. I've also heard the number 80, but I've heard the number 60. So I'm not sure which level that would be at. And I know that those plans are still being worked on literally as we speak. That was an issue that came up at caucus just on Tuesday. I guess it was. Yeah, Tuesday we got a briefing. So it's a little bit tricky too, because there's things that change. I'll give a good example. So last summer, right? Things were looking pretty good. We were under 100 cases for a few days, even for a couple of weeks. And if you'd asked me beginning of August, I would have fairly confidently said I thought that we had been through the worst of it. We'd avoided the surge that everyone was talking about, and we would see a continual lifting as we had pretty much all last summer. There was just a continual lifting of more restrictions. But then, of course, we saw the surges take over in the fall. Now, I don't think that's going to happen the same way next fall, but I think because of what we've seen this fall in December and January, there's going to be a wariness of getting too comfortable and then having a repeat of that. So I think you won't see a complete lifting of everything. I think you'll see far fewer restrictions, far more leniency, and far more freedoms that are recognized. But at the same time, I don't think, because of the experience we've had last fall, that everything will be back to normal by June or July.
Yeah. One issue I was researching with like the number of like the threshold for immunity, like say if it is like 60, 70, like 80%, like whatever's being talked about right now, like it just seems like that's virtually like impossible, because children under 18 are ineligible for the vaccine. Women who are pregnant or are contemplating becoming pregnant, and people who have protein allergies are all being discouraged from getting it. And that already takes away like 20 to 25% of the population off the table. And then there's 10% of Canadians that refuse to get it. And then there's the 30% of Canadians who are unsure. And I'm just afraid that we will never reach that threshold of immunity. And also the fact that corona mutates. Like there are currently 4,000 new confirmed strains of COVID-19. And Pfizer and Moderna came out and said that their vaccines will only cover the UK variant, but not the South African variant. And Moderna came out and said that their vaccine will only be good for the year. And I'm just concerned that by the time like everyone is vaccinated, we're gonna be like back at ground zero. And I find like it just seems like we need a bit more like sustainable lockdown strategy with dealing with COVID-19 because like it's not going away anytime soon. And it's now being called like an endemic by multiple health professionals, which means we won't be able to get rid of COVID-19. We just have to learn how to deal with it and how to develop sustainable strategies to protect people from it. So I was just wondering if there's any other like exit strategy that the government is working on or considering that would prevent like more lockdowns from happening, but also like protecting people.
Yeah, so I think you've hit the nail on the head with the need for a multiple pronged approach and restrictions or at least public health measures that will be sustainable, because I totally agree that it's just not sustainable both for society and for the economy and for people's broader health, aside from sort of a reductionistic COVID perspective on going back to lockdowns every 4 months or 6 months or whatever it is. I just don't see that as being psychologically sustainable, bluntly. Yeah. And I think that's something we all recognize as well, at least from all the conversations I've heard. I haven't heard a single person who's like, oh yeah, let's just keep going back into lockdowns every fall and spring. That would be a lot of fun. So I think from my perspective, from what I've heard gleaning between caucus and public health meetings, even just this afternoon was on one with our local Dr. Hergy and regional councillors, I get the impression there's going to be a threefold exit strategy, just combined with vaccination, regular herd immunity, and the fact that viruses do, and as pandemics throughout history have done, as they move through their waves, they weaken, and yes, they mutate, but they also become less, or usually they become less dangerous, right? So what we've seen in the past is, even though, for example, these variants that you're referring to, even though they're more transmissible, they don't have any greater impact when it comes to their death rates. And so if we're able to see that people are being cautious, and most numbers of people who get it, but for the vast majority of people, it doesn't have an impact on their day-to-day, because the majority of people are either vaccinated, have developed immunity, or it's in a weakened form. I mean, there's still forms of Spanish flu going around, if my memory treats me correctly, that have over time just evolved into a lot of different things, but we've been able to work through that. So I think there's a threefold: herd immunity, vaccination, and evolutionary weakening of the virus that will lead to long-term the exit. Now, I don't know if that's going to be in 3 months or 6 months or a year, but I'm quite confident that even if we don't hit that 60, 70, 80% of people this summer, which I do believe we will. Like, even yesterday I saw polling that shows 89% of Canadians want to get the vaccine as early as they possibly can.
Okay, that's good.
That's an extremely high number from my perspective, and frankly, if people want to be part of the 10%, that's their right, and I don't think that will have too much impact, just like other viruses or other vaccines. So if you have 89% coverage, even of that, 80% of people you said are eligible because of the youth and pregnant women, and a couple of other subcategories that you mentioned with
roughly.
Yeah, so even if you have that, you're talking a significant portion of the population that, again, the whole impetus behind restrictions is to protect the healthcare system and ensure that there's adequate coverage for everybody else who needs it for whatever purposes, whether that's an accident or a surgery or a disease. And so I can't see that having a drastic impact on our healthcare system to the point that we're going to be willing to carry the economic and social loss of restrictions.
Okay.
Does that make sense?
Yeah. Sorry, I'm just like gathering my notes.
Yeah, no problem.
So
again, no one I know, I haven't met a single person who wants to do these any longer than they absolutely have to, except for like a few unions.
Yeah.
Aside from that.
Makes sense. Um, yeah, so I'm just wondering, like, with the lockdown exit strategy, like, is there like a time frame that like the government is hoping to achieve with it?
So I would say we're in the beginning of that exit strategy as we speak, right?
Yeah.
I'm sure you've seen over the last month or so as we've moved into the zones, back into those zones, a huge amount of pushback from certain areas. I would say some of the federal government, obviously some of the local public health units, some of the academic institutions, and some of the health groups, whether those are unions or hospital organizations, saying we're moving too quickly and everything like that. But we are determined to still move forward in this regards. The premier is determined to move forward in this regards unless there's compelling evidence to the contrary. So that framework is already being implemented. Now the question is always, okay, well, what happens when everyone's at 30%? Not 30%. When everyone's at the green zone, life in the green zone is still with way more restrictions than a normal society, right? And we recognize that. That's a question that I actually just asked Minister Elliott a couple of weeks ago, and she said there is work being done on beyond the green zone, what that looks like, and going back to 100% normal for everything, like 2019. Although, I mean, obviously, there's going to be societal and other things that have just changed, so we'll never quite go back to that. Although the restrictions are on, but that plan will. It's a little. Here's the problem with that plan, right? So if we come out today and say, hey, when we all get back to when we all get into the green zone, then we're going to release, or we're going to say, here's where we're going after that. Then everyone says, okay, that's great. And then next week the numbers surge and we're back in gray. Let's just say here in Niagara, for example. And you said, well, thanks for giving us all this hope, and then dashing it to the ground. I think there's a perspective that it's better to try recognize where we are and not just jump ahead of that curve. But again, the vaccinations have been coming faster than we anticipated, and that's already had a huge impact on hospitalization rates here in Niagara. And if that's being replicated across the province, I'm very confident that what we're exiting right now, will have been the last true lockdown that we will have had to experience as a result of COVID.
So are you is there not a lot of concern about the new strains, like, or variants of COVID, and like concern of like having to lock down for these new variants?
There are in certain circles, but the problem is even there. So even if these variants surge, which is don't get me wrong, I could be totally wrong and they could just take off like crazy.
Yeah.
But even if they surge, the death rate among vulnerable populations and the hospitalization rates won't be what they were. Right? Because all long-term care homes and congregate care settings have been vaccinated in Niagara, for example, but across the province. So let's say we went up, we were at a couple hundred cases a day was our peak in the beginning of January here in Niagara, just specifically. I'm just going to stick with the Niagara example. So at a couple hundred cases a day, we were having multiple people die every day, like a number of people die every single day. At one point we had like 20 deaths, which is really tragic. So that won't happen. Even if tomorrow we went back up to 200 cases a day, even with the lag, you would have a far diminished death rate because of those vulnerable populations being vaccinated. And then, of course, with the 85 plus, and then moving forward as of March 15th, anyone over, first 85, but then going down into the 60s, hopefully by the end of April. Again, the greatest correlation for what a risk factor is that age piece, and if those are all vaccinated, the risk ratio drops substantially. So I'm confident our healthcare system can bear a much higher caseload than they could with, even of the variants of concern, than they could with the regular COVID, just by virtue of the immunity built into those populations.
With all due respect, the other problem with that, this is Beth, by the way. With all due respect, the other problem with that is that, yes, the case fatality has gone down in the older folks because we've also lost so many of them. Like, we've lost the most vulnerable. So this doesn't really have much, I mean, it's not entirely taken by the vaccines and the improved healthcare of the elderly. It's because we lost so many already.
So So I think there's a percentage of that is true, but there's also a huge correlation that if you look at where, because people are always aging, right? And people are always becoming more vulnerable. So if following that logic, then after the quote unquote dry tinder was cleared, which is terrible, but for those people, you would arguably just see more dry tinder being created because people go downhill very quickly in long-term care homes, right? And many of them, it's like in a couple months they're in fairly poor condition, and that's tragic and frankly unacceptable. But that doesn't change the fact that that's not what we've seen as these vaccines have been rolling out. We've seen the death rate diminish far faster than the infection rate would suggest.
Okay, but then that leads to, why are we still in this?
But that's why I'd argue we're coming out of it, right? We have far fewer restrictions now than we did a month ago, and I'm confident a month from now we should be seeing fewer again, and that process will continue. So I agree. A big one for me is percentages. I think we should have percentages in a lot more places than we have hard numbers. So that's one of my internal struggles that I'm always working on. But that doesn't mean we can just lift everything. It means that we can hold on to the progress we have, and hopefully be able to build on that progress without losing it due to those variants.
Personally, I'm very frustrated by the only showing the number of cases and not the rates. I'm actually an epidemiologist as well, by the way.
Okay. So
I'm very frustrated by that, and because, I mean, any moron can give a numerator, but the art is in the denominator. You know, who are we counting here, and why are we not doing random samples? Frankly, like I'm a biology teacher now, but I am a trained epidemiologist. And my school, Smithville Christian High, we shut down today. Today we have shut down again. We don't have a single case, and we shut down.
Why did you shut down?
The neighboring schools, I guess, and just in the general, the school community, but we don't have a single case, and we've just shut down.
So, but that would not be us shutting you down.
Yeah.
Right?
Yeah. I don't know. I mean, it's very frustrating because I am an epidemiologist, I guess. And
yeah, no, for sure. And I'm not trying to challenge your expertise.
Yeah.
I'm not. So I'll take your word for it every day over mine.
Yeah. Yeah. I'm frustrated with the case count. I'm frustrated with how they're being counted, how they're being diagnosed. I mean, I was even looking today into, the ICD codes for coding of death, and, what new codes have they been generating because of COVID, and, how they're being used. And, it's all just very frustrating. And, I don't know. It seems like this is, drawn out for too long. I don't know.
No, and I think that's a fair argument. Yeah, I'm always trying to be deferential to people like yourself too, and recognize that I don't have that expertise, and if they say it's going to be taking off exponentially without that, I respect that knowledge. At the same time, trying to just bring to their attention and the public health table's attention the fact that there's collateral damage, which Rebecca's done a very good job of enumerating. That also has to be considered. You can't take a reductionist approach that only recognizes COVID, right?
Yes. It seems like that's kind of the easy one to handle, and the other ones are far, far, far more difficult and complex to deal with, and we're only kind of picking off the easy ones of cases.
No, that's a fair point. Yeah. I guess the challenge that I personally have is trying to raise these issues in a thoughtful way that demonstrates integrity and compassion, also that recognizes I don't always have all the answers. And so trying to bring forward pieces of advice and recommendations such as Rebecca's, those are pieces that I do believe in doing, especially as a person trying to represent my constituents, and I don't take that lightly.
It just kind of appears like that there hasn't, like, at least publicly, like there hasn't been like a proper cost benefit analysis done. Like, I'm not saying that there hasn't been one within the government, but I find that there's just a lack of conversation around like the like quote unquote collateral damage and that it doesn't really seem like it's being taken into account when every press conference that happens.
Yeah, it is challenging because I understand what you mean, because there's not an accurate weighing of a lot of these other factors, right? You're saying whether it's you mentioned your friends with suicide or
overdose.
Overdose.
Mm-hmm.
Yes. So those pieces. Part of the problem is there's such a lag in data, right? So I've asked this question about suicide, and they only have the suicide numbers up until last August. So they don't have all that data, but what they say is that the ideation has increased, but the actual suicide itself has not substantially increased. So that's the argument. And the other argument is, okay, well, suicides might have increased nominally at least a small amount, but that doesn't detract from the fact that even if we said, okay, these increases are bad, that doesn't just end the increases the second you lift the lockdowns, but now all you've done is you have the suicides and you also have the COVID pressures on your healthcare system as well as that. Now, how do you verify some of that? Some of it you can't. Yeah. Some of it is a little bit of a Russian roulette, and this is one of the things I've said multiple times to my colleagues. We could have been completely right and saved 180. So the very first caucus meeting I was ever in, they told us we were going to have 180,000 people die by June in Ontario. And so we could have been, and I highly doubt that would have happened if there hadn't been action taken. Maybe we would have seen, I think we would have seen significantly higher than what we did see if there hadn't been action taken. But I don't think it would have been 180,000. But let's say that was actually what was going to happen, right? It's very much this case of, we can say, oh, we stopped 180,000 people from dying, but how do you prove that?
Exactly. Yep.
Right?
Yep.
And
absolutely.
vice versa, people see what's happening in these areas. For example, the tragic story of your friends, and it's very hard for me to say, well, that wouldn't have happened if we hadn't had lockdowns. Just like it's hard to say that we wouldn't have saved those lives if we hadn't had lockdowns.
Yeah, and I'm currently studying my bachelor in social work, and I have I have a placement and a co-op, and I also work at a group home. And I know that suicidality has increased, and I know that it has been expressed by the youth I work with and the residents at the group home I work with, that it is because they feel like they can't see their families and that everything is shut down. So I know there might not be that official data that backs that up, but I'm hearing story after story of youth going on Instagram saying I can't take this anymore, or message, or I get messages from the youth that I serve just saying I don't know how much longer I can stay away from my friends. My friends are the only thing keeping me alive, and now that they feel like that's being taken away from them. So obviously, yeah, we don't have the official data, but there are the stories and that suggest that the data should be investigated more.
Right.
Yeah.
No, that's fair, and I think there's going to be a lot of analysis. I really think there's going to be a lot of things where down the road we'll say this we did right and this we did wrong, and man, we didn't have done that, and we could have done this better. I totally recognize that, and that's why I'm always trying to learn as well from people like yourself. I think you raised some really important points.
There'll be 1,000 PhDs after this.
Oh yeah, that's all we need.
I've been saying that for a while now.
So I unfortunately do have a committee I have to be on a minute ago, so I am going to have to cut it off here unless you wanted to make sure that we reconnected next week or something. I don't know what is best for you, if this is the conversation you were looking for, or if you wanted to go into more depth. Just what are your thoughts on that?
Yeah, I would like to have another conversation because I just had a few interviews with the Long-Term Care Commissioner's Office, and I'd like to also bring up concerns around that as well.
Absolutely.
Yeah.
Okay, would you be willing to send an email then to my office, and we'll just make sure we set it up again for next week?
Yeah, absolutely.
I'm sorry I had to cut it off. It's just I'm on a select committee that I have to be on.
That's okay.
2 minutes ago, so I apologize.
Thank you so much.
Yeah, thank you for your time.
Be well.
Okay, bye.
Bye.